1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Before we start with our webinar proper this afternoon, may I remind you of some ground rules. Make sure you have a stable internet so that you will not miss any of the important topics of the webinar. Make sure your microphone is on mute. Turn off your camera during the speaker's presentation. Should you have any queries or comments, you may type them at the message box or at the comments box. Type your name and your school affiliation or institution to be recognized. You may wish to take down important points mentioned by the speaker. Good afternoon, ladies and gentlemen. This is Dr. Marieta R. Fabros, and I will be your host for this afternoon's webinar entitled Ethics and Social and Health Science Researches. Okay. To start with, let us listen to that doxology.
That I am and all that I have, I lay them down before you, oh Lord, and all my regrets and all my acclaim, the joy and the pain, I'm making them yours.
Things in the past, things yet unseen, wishes and dreams that are yet to come true. All of my hopes, all of my plans, my heart and my hands are lifted to you.
Lord, I offer my life to you. Everything I've been through, use it for your glory. And Lord, I offer my days to you, lifting my praise to you as a pleasing sacrifice. Lord, I offer you my life. That I am, that I have, I lay them down before you, oh Lord, and all my regrets, all my acclaim, the joy and the pain, I'm making them yours. In the past, yet unseen, wishes and dreams that are yet to come true. All of my hopes and all of my plans, my heart and my hands are lifted to you. Lord, I offer my life to you. Everything I've been through, use it for your glory. And Lord, I offer my days to you, lifting my praise to you as a pleasing sacrifice. Lord, I offer you my, Lord, I offer my life to you. Everything I've been through, use it for
May I request that all of us to stand up for the Philippine National Anthem. This will be followed by the PWU hymn. Let us now take our seats and listen to the opening remarks to be given by Dr. Menchita F. Dumlao, Chairperson of the Ethics Board of the Philippine Women's University.
Good afternoon to everyone. It is my pleasure to welcome all the participants. Good afternoon, everyone. Yes, can you hear me?
Yes, Doc, we can hear you.
Okay. So thank you very much for. Can we request Marietta to please turn off the cam first? Thank you very much, ma'am.
Okay.
Good afternoon, and it is a pleasure to welcome all the participants, all of the eminent speakers which are here today, to our guests, to our President, Mr. Marco M. Benitez, SBPAA and Chancellor, Dr. Felina Siyang, to the organizers who work hard for this webinar, Dr. Nini Lim, Dr. Nancy Felipe, Mr. Harvey, Mark Harvey Adamson, um, and to the rest of the committee, a pleasant good afternoon to all of you. And I also would like to thank our eminent speakers, Dr. Leonardo de Castro and Dr. Jacinto Blas V. Mantaring, for being here today and for their willingness to share their expertise to the rest of PWU community. This is the first conference in the history of PWU pandemic period. And as we may say, this is completely conducted on a digital platform in line with social distancing and social distancing norms amid COVID-19 pandemic. And as we have been discussing today, this webinar, which is entitled Ethics on Social Conference, is conducted along with the active coordination and collaboration of different schools in allied health clusters. Okay, so sorry for that. Yeah, I was disconnected due to some internet problems. So if I may continue, I think I am on the part that I'm saying that we are very proud to announce that this webinar is the really first in the history of PWU discussing a virtual conference or research webinar on the topic of ethical or review of ethics to meet when they conduct their researches, both on health sciences and non-health or the social sciences. So we hope that this seminar will enlighten our students and researchers on the proper standard operating procedures, understanding of informed consent, and the proper conduct of interviews, focus group discussions to be able to ensure that the rights in terms of privacy and data of our respondents are well taken care of. So
Dr. Mencita Dumlao has problems with her internet connection. Okay, so we may proceed now. Thank you, Dr. Dumlao. May I now take this opportunity to introduce all of you to our esteemed PWU President, Mr. Marco Alfredo M. Benitez, who will be giving us an inspirational message.
Good afternoon. Thank you to Dr. Nini Lim, President of the PW Doctor of Education Alumni Chapter, and of course, our MSDC Director for the opportunity to speak to all of you today at this webinar on ethics in social and health sciences research. Thank you as well to our distinguished speakers, Dr. Leonardo de Castro, Chair of the Philippine Ethics Board, and Dr. Jacinto Blas Mantaring III, Chair of the UP Manila Research Ethics Board, for taking time out of your busy schedules to share your insights with us on the topic. Good afternoon as well to all our participants watching on the PW social media pages. It can be argued that in our lifetimes, never have we seen the rise and recognition of the importance of science, health and medicine in particular, as what we have seen in the past year as a result of the COVID-19 global pandemic. From the discovery, detection, testing, and mitigation efforts to stop the spread of the virus, to the development of treatments, therapeutics, and ultimately vaccines that will help end the pandemic, the world has relied on science as it has never done before. The reason for this is because science is based on empirical data that is founded on evidence which can be verified, reviewed, transparent for others to see, and conforms to the strictest of standards, both ethical and scientific, thus allowing people to more easily place their trust in its findings. Ethics can be defined simply as norms of conduct or moral principles that distinguish between right and wrong. But when applied to research, such as the development of a safe and effective vaccine, for example, it goes beyond that. It refers to a set of rules or code of conduct that govern the collection, analysis, reporting, and publication of research subjects, in particular, the subject's right to confidentiality, privacy, and informed consent. Adherence to these ethical norms is important because these norms promote the aims of the research, such as the search for knowledge and truth. It promotes values that are essential for collaborative work, such as trust, respect, integrity, and accountability, thereby also building public trust and support in the research. Last but not the least, these norms promote moral and social values such as human rights, animal welfare, social responsibility, and public health and safety, to name a few. In the context of the social and health sciences, these norms take on an extremely more significant aspect, as moral and ethical decisions involving the rights and lives of patients or participants come into play. The researcher must then be always conscious of the need to know and adhere to these ethical principles. Thus, as a university that continually seeks to enhance the quality of our research and its relevance to society, we cannot overemphasize the importance of placing ethics in research in the highest regard. We would therefore like to thank once again our speakers for taking the time to be with us today, as they are leading experts in this field, and the organizers of this event for the timeliness and relevance of the topic. Thank you, and I look forward to the insights that will be shared this afternoon.
Thank you, Mr. Benitez, for that inspiring message. May I now introduce our first guest speaker, who will talk on the current ethical issues in health-related social science research. Leonardo de Castro is professorial lecturer at the University of the Philippines, where he was chair of the Department of Philosophy from 1991 to 2000 and full professor until he retired in 2010. He is currently chair of the Philippine Health Research Ethics Board, the national policy-making body on health research ethics, which is also responsible for promoting public awareness of the importance of ethics in health science. As member of the UNESCO Advisory Expert Committee for the Teaching of Ethics, he contributed to the development of a core curriculum on bioethics for the agency's ethics teacher training course. In addition to being lecturer for the ethics teacher training course, he has participated in UNESCO's Assisting Bioethics Committees program that has provided orientation and training for capacity development of national bioethics committees in resource-challenged countries. A consistent contributor to global bioethics education, he has been involved in ethics teaching in Cyprus, Greece, Malawi, Nigeria, Uganda, Zambia, Brazil, India, Pakistan, Egypt, Indonesia, Macau, Bangladesh, Sri Lanka, Mongolia, China, Cambodia, Korea, Vietnam, and Laos, while serving as a consultant to the European Commission, the United Nations, the European Union, UNESCO, and the World Health Organization. Professor De Castro has been a member of the board of the International Association for Education in Ethics and of the International Association of Bioethics. He was a member of the International Dialogue on Bioethics that provided a forum for the exchange of ideas among representatives of European and non-selected national bioethics committees. He has been editor-in-chief of the Asian Bioethics Review, president of the Asian Bioethics Association, Vice President of the UNESCO International Bioethics Committee, and Vice Chair of the Forum for Ethics Review Committees in Asia and the Pacific. As a Senior Research Fellow until 2017 at the Center for Biomedical Ethics at the National University of Singapore, he directed a capacity development program in research bioethics. He commissioned a play depicting bioethical concerns that was staged at secondary schools throughout the country with the aim of raising public awareness and understanding among the youth. The play entitled Future Perfect also provided a platform for inter-country video conferences among secondary school students that he facilitated. As keynote speaker, Professor de Castro addressed member countries of the United Nations at a meeting of the Ad hoc Committee on an International Convention against the reproductive cloning of human beings in New York in 2002 and addressed member countries of UNESCO at a roundtable of ministers of science in Paris in 2001. During his chairmanship with the Department of Philosophy at the University of the Philippines, ran community of inquiry workshops with primary school teachers and pupils in Manila. He uses the model for bioethics teaching at all levels. Professor de Castro earned his PhD in philosophy from the University of Wales. His awards include Takashi Fuji Prize, International Federation of Social Science Organizations, National Book Award, Manila Critics Circle, Outstanding Monograph Award, National Academy of Science and Technology, Outstanding Research Award, Centennial Professorial Chair, and several international publication awards from the University of the Philippines. Ladies and gentlemen, let us all welcome Dr. Leonardo de Castro.
Magandang hapon po sa inyong lahat. Magandang ayaw na ang gumalaw yung aking screen. Good afternoon. Naririnig po ba ninyo?
Good afternoon, Doc.
Oo, naririnig nyo ba ako?
Yes, Doc.
Share. Sandali lang. Ayaw lumabas yung aking slide presentation. Ano ba gagawin ito?
Yes, Doc. Do you need any assistance from us?
Ano? Nakikitaan niyo ang
Yes.
slide? Okay, good.
Yes, Doc.
Okay. So, good afternoon. Ang objectives para sa presentation na ito ay magkaroon tayo ng enhanced awareness of ethical research, paggalang sa mga research participants, at maging handa na mag-apply ng ethical principles sa pagsasagawa ng research. Siguro Chapi ang dating ng boses ko sa inyo. Hindi po yan dahil sa inyong internet connection. Ako po ay merong voice disorder na tinatawag na spasmodic dysphonia. Pero hinayos ko naman po ang aking slides para pagka kayo ay, if you pay close attention to the text in the slides, ay masusundaan ninyo ako. Kung hindi nyo napansin na merong grammatical mistake sa aking slide, ay siguro hindi tama ang inyong ginagawa. Okay po ba? Okay, ako ay narito bilang chair ng Philippine Health Research Ethics Board na siyang national policy making body on health and health-related research. Ang kapangyarihan po ng FREB ay batay sa Philippine National Health Research System Act or Republic Act 10532 noong 2013. So, dapat naming isagawa ay ang proteksyon ng mga taong kalahok sa pananaliksik. So, para may sagawa yung aming mandate, dalawang bagay ang pinakamalaki aming ginagawa. Ang una ay ang formulation at saka implementation na ang national guidelines tungkol sa health at health-related research. Ang pangalawa ay ang pag-accredit na ang mga Research Ethics Committee, yan pong mga committee na yan, sila naman na ang nagre-review na ang mga research proposals. Kung meron kayong mga tanong mamaya tungkol dyan, ay maaari kong sagutin. Otherwise, meron naman po kayong makikita sa website ng FREB at yung guidelines din ay makikita rin ninyo sa website. Okay, ilang mga definitions muna. Ano ang itinuturing na human research? Yan ay yung mga activity na gumagamit ng scientific methods, nagko-contribute sa generalizable knowledge, at sila ay tungkol sa human participants. Ano naman ang may tuturing na health research na gumagamit ng human participants? Kasama dyan yung mga sitwasyon kung kailan ang human beings ay exposed to manipulation, intervention, or observation. Pwede rin namang hindi directly nagkakaroon ang intervention sa tao, at sa halip ang intervention ay sa kanyang environment. At itinuturing din na health research with human participants kung merong identifiable human biological materials or medical records na siyang minapanipulate o obserbahan o subjected to intervention. So, hindi lamang mga dugo or buto o muscles ang itinuturing ay obserbahan sa mga eksperimento, kung hindi ang behavior o ang kilos mismo ng tao. So, ipapaliwanag ko ang ilang mga prinsipyo na ginagamit para suriin ang etika ng pananaliksik sa pamamagitan ng mga case studies. Itong unang case study ay tungkol sa tourism and safe sex practices. Ito ay isang pag-aaral tungkol sa possible impact of tourism on sexual health. Makinig kayo ng gusto o subaybayan ninyo ng gusto ang mga slides dahil maya-maya ay tatanungin ko kayo tungkol dito sa slides na ito. Ano ang study question dito sa research na ito? Gustong malaman yung bang mga sex workers ay kinukumbinsi ba nila ang kanilang mga male clients na gumamit ng kondom? Paano nila ito ginagawa? At sila ba ay porsigido? Hindi ba sila papayag hanggat hindi nakasuot ng kondom yung kanilang mga kliyente? Mahalaga ito dahil gustong makakontrol ang pagtaas na ang incidence na ang HIV/AIDS doon sa lugar na yun. Naisip nila na kapag tatanungin nila na ang diretsahan ang mga sex workers ay hindi magsasabi ito na ang katotohanan. Ganun naman ang in-expect natin, hindi po ba? Kaya ang ginawa nilang metodo ay participant observation. Yung mga researchers ay nagkunwari na sila ay naghahanap na ang karanasan sa mga sex workers. Sa totoo lang, meron pang karugtong itong research na ito. Kaya kung gusto ninyong sumama at maging researcher, ay sabihin lamang ninyo sa akin pagkatapos nitong presentation at nang makaranas kayo. Pero natatakot yung mga researchers. Sila ay mapasubo mismo sa tunay na sex. Kaya meron silang mga accomplice na tutulong sa kanila para wag sila tuluyang mapasubo. Pero ang dapat tandaan sa research na ito ay walang informed consent. Kasi nga naman, kapag sinabi ninyo doon sa kababaihan ang pakay ng research, hindi na nila kayo pagtatapatan ang katotohanan. So, pumunta sa isang ethics committee itong research at ang ethics committee ay nag-approve. Pero sabi nila, kailangan bayaran niyo pa rin yung mga kababaihan para sa lost opportunity. May pagkukulang yung ethics committee. Pero nung sinubmit na yung kanilang resulta sa isang journal para ma-publish, yung nagbasaan ng kanilang paper, napansin, gumamit sila ng deception. Walang informed consent. Kung gayon, hindi ko papayagan nito na ma-publish. Sabi niya, walang informed consent. So, a few things tungkol sa informed consent. Kailangan voluntary o kailangan walang deception or intimidation doon sa mga kasama. Hindi tulad noong kita ko sa news kagabi, sabi noong mga general, yung mga sundalo na babakunahan, hindi sila maaaring tumanggi sapagkat ipinag-uutos daw yun sa kanila. Hindi man yun research, ay hindi pa rin valid yung pag-uutos na hindi nagsasaalang-alang sa kusang loob o informed consent. At kailangan din ang opportunity na makapagtanong yung mga gustong hikayatin na sumama. Maraming information na dapat ibigay, katulad ng mga objectives ng research. Ano yung kailangang gawin na ang mga participants, gaano katagal nila dapat gawin ito, at mahalagang alam nila na sila ay may kalayaan na sumama o tumanggi. At kung makapag-umpisa man sila, maaari silang mag-withdraw kung nakita nila na sila ay maaaring mapahamak. Kailangan din malaman ang benefits and harm, kung paano papangalagaan ang kanilang privacy at ang confidentiality na ang impormasyon tungkol sa kanila. So, tanong ko ngayon sa inyo, justified ba yung gamit ng deception? Ano sa palagay ninyo? Sa totoo lang, naganda ako ng poll para sa inyo. Pero ngayon, ang nasa harap ko lang ay ang screen na ang PowerPoint presentation. Kaya hindi ko na alam kung paano gagamitin na ang poll na ito. Pero para huwag tayong magtagal, isipin nyo na lamang, sa tingin nyo ba justified ang paggamit ng deception? Yun pa ang mga kababaihan ay naperwisyo dahil sa deception. Sa papaanong paraan sila naperwisyo? Kung meron ang perwisyo, yun ba ang mga perwisyo na yun ay justified pa rin dahil sa benefits na maaaring makuha dahil sa pagsasagawa ng research. So, makikita nyo rito ang mga tanong na dapat sagutin para masabi natin kung ethical o hindi ang research na isinasagawa o palaki sa gawa. Maririnig din ninyo kung minsan ang terminong vulnerable. Yun ba ang mga kababaihan na iyon? Paano sila naging vulnerable? kailangan ba nila ng tulong dahil doon? Sila ba ay napagsasamantalaan? At yun ba ang pagpapatuloy ng research? Hindi ba yun makapagdudulot na ang masama sa iniisip natin tungkol sa mga kasama o kalahok doon sa research? Meron bang pagiging bunga na stigmatization o discrimination? Na-violate ba yung kanilang privacy? At kung sakaling ma-publish o matapos ang research, okay lang ba na i-publish yung mga resulta at tukuyin kung sino ang mga kasama sa research? Yung publication naman, kung pipigilan natin, hindi ba magiging limitasyon sa transparency na kinakailangan para sa research? So, eto sana yung kasama sa poll. Taking all of those things into account, was it ethically acceptable to proceed without informed consent of the sex workers? Pwede bang i-request ko yung mga participants na ilagay nila sa chat yung kanilang sagot? O sabihin lamang inyo yes or no. So, 10 seconds to do that.
Hi, Doc. Most of our participants are watching through our Facebook Live, so there is already a live chat box here, and there is a short delay of our live streaming. So I'll be telling you their answers, Doc. And
Okay lang.
okay,
Ano ang maraming sagot?
most of them, Doc, are saying no. In fact, there is no one who are saying yes. All of them, I think, are saying.
Okay. Oo, mahigit naman. Kung itong susunod, ano ang naging dahilan para sa inyong sagot? Andiyan na ang ilang mga options kasama nung mga bitanggit natin kanina. So, pwede bang sabihin sa chat kung ano ang dahilan? Hindi ko nakikita yung chat.
Yes, Doc. Again, some of them are already chatting using the chat box in our YouTube live stream. Okay, we are still waiting for their answers. One of our participants mentioned no informed consent. Okay. Again, for the participants, please use our chat box in our Facebook Live. The other one is mentioning deception.
Okay.
And we have
okay.
no informed consent.
Ipagpatuloy lang nila para at maaaring makita ko rin yung chat. Itong susunod na tanong, pwede bang ang informed consent ay bigayin ang isang proxy, yung bugaw o pimp noong mga sex workers? Ano sa ating ininyo? Kasi yung bugaw, siya ang nagre-represent sa sex worker sa kanilang mga transaction. So, pwede bang sila ang magbigay ng informed consent?
Again, Doc, I'll be reading their answers from our YouTube live. And they are saying no. Most of them are no and not acceptable. No, no. And, yes.
Okay. Very good. Very good. Kasi bagamat yung bugaw ang nagre-represent sa kanila sa mga sexual transactions, hindi kasama sa authority na ibinibigay ng mga sex workers sa kanila yung pagbibigay ng informed consent para sa research. So, hindi saklaw yun na ang kaniyang kapangyarihan. Ang surrogate consent ay maaari lang ibigay na ang isang legally authorized representative. At yung bugaw ay merong tinatawag na conflict of interest. May conflict of interest siya dahil ang gusto niya siyempre ay pumayag na ang pumayag yung kaniyang sex worker dahil pagka pumapayag yun, siya ay kikita rin na ang mas maraming pera. Ang isang paraan na isinasuggest para sa ganitong research ay kumuha ng informed consent, ipaliwanag sa mga sex workers in advance. Hindi sasabihin sa kanila kung sino mismo ang mag-i-interview at kung kailan gagawin ito. So, maaari silang magbigay ng consent at pagka nag-consent sila dahil hindi nila alam kung kailan gagawin ang interview at kung sino ang mag-interview ay mahihirapan siyang magkunwari pagdating ng actual interview. Okay? So, mapunta tayo sa isa pang kaso. Ito na ay tungkol sa pag-oobserba sa kung paano mag-alaga sa mga newborn yung mga pamilya. Ito ay isang observational study lamang para ma-promote ang tamang pangangalaga sa mga bagong panganak. Ang setting ay isang komunidad na mataas yung mortality rate ang mga bagong panganak. So, ang ginawa dito, yung mga field workers ay nag-observe lamang at ang kabilin-bilinan sa kanila, mag-observe lamang kayo. Huwag kayong mag-intervene. Huwag kayong magpakita ng pagsang-ayon o hindi dun sa ginagawa para ang makita ninyo ay kung paano yung pangkaraniwang ginagawa nila. So, nagbigay muna na ang permiso yung mga barangay head. Sila din yung nagtukoy kung saan merong mga bagong panganak at sila yung unang kumausap doon sa mga magulang. Ang tanong ay yun bang mga researchers ay kailangan pang kumuha ng informed consent mula sa mga mothers? Yes or no? Meron pa ang mga sagot?
Yes, Doc. I'll be reading their chat through our YouTube live. Again, to all the participants, please use the chat box in our YouTube live.
Natutulog na ata.
Okay, I'm seeing now their answers. There is actually a bit delayed. Most of them are saying yes, Doc.
Kailangan natin ng informed consent. Kasi kahit na yung mga community leaders ay pumayag na, sabi ng Helsinki Declaration, at gano'n ang ating pangkaraniwang patakaran, yung individual mismo kailangang magbigay ng informed consent. Kailangan lahat ng gustong malaman na ang reasonable person merong naumit dito na salita. Yung reasonable person, yung gusto niyang malaman tungkol sa aims and benefits at compensation. So, gaya ng sabi ko kanina, nag-observe sila without intervening at nakita nila yung nanay ay kumuha ng tubig mula sa balon at yun ang ginamit pagtimpla ng gatas. Alam nung field worker na yung bata ay maaaring magkasakit kung yun ang gamit para sa kanyang gatas. Maaari pang ang ikapatay. So, ang sabi sa mga field workers, huwag kayong makialam. Mag-obserba lamang kayo. Tama ba na yung field worker ay mag-observe nga lang at hindi makikialam? Oo, hindi.
Okay, Doc, we are waiting for their responses.
Kaya ano kaya ang iisipin ninyo? Isipin pa ninyo o kabilin-bilinan sa akin. Huwag na huwag akong makikialam. Baka ako pagalitan. Baka masira itong aming research. Kasi ang sabi sa protocol, huwag makikialam.
Okay, Doc, I've been seeing some answers and their answers are mostly no. But I think 2 or 3 participants are saying yes.
Okay. Yes nga ang hinihisip. Dahil siguro kung yun ang bilin sa protocol, ay baka naman merong paraan pagkatapos para ma-reverse yung aring perwisyo doon sa bata. Pero in general, kung ganito ang sitwasyon, ay hindi tama na huwag makialam. Ang solusyon dito, walang dahilan kasi yung well-being na ang research subject at kasama doon hindi lamang yung nanay, kung hindi yung ding kanyang anak. Ang kanilang well-being must be more important than other interests. At ang tamang solusyon doon, umpisa pa lang sana doon sa protocol o doon sa manual na ibinibigay sa mga researchers ay sinasabi na kung ano ang maaari nilang gawin kung mangyari nga ang mga ganoong sitwasyon. Maaaring sabihin doon, hayaan mo lang hanggang sa halos isubuon sa bibig ang bote, pero kailangan alis ka para huwag matuloy. O kaya pwedeng may iba pa instructions. Okay. So, itong kasunod na halimbawa ay tungkol naman sa online research. At ito ang description. Ito ay internet-based study to explore the knowledge of local food heritage by Batangueños. At sa phase 1 ng research, ang balak na gawin ay harvesting na ang social media posts tungkol sa mga Batangueño food by netizens indicating Batangas residents or Batangas roots. Okay. Yung mga posts na ay na-harvest ay accessible sa mga researchers kasi yung setting na ginawa nung may account, nilagay niya sa public yung mga posts na yon. Yung harvesting ay ginawa without the knowledge na ang mga social media account owners nasusundan ninyo. Ang tanong ayon, ang mga researchers na nangangailangan ang informed consent mula sa account owners para ma-harvest yung kanilang public social media posts. Sige nga, sagutin nga ninyo. Ulitin ko, yung public ay nakikita ng mga researcher kasi hindi inilagay sa private setting noon mismong naglagay ng post. Pag-post nila, paari natin ipalagay na alam nilang yun na ay public. So, ano ang inyong sagot? True or false? Yes or no?
Okay, Doc. I think there are some participants who answered true, and some of them are false. It's quite half of them are saying true, half of them are saying false. So there's a bit of confusion here from our participants.
Okay. So, inaasahan natin yan sapagkat ito ay controversial pa rin tungkol sa research. No? Ang sabi nga, gaya ng naipaliwanag ko, nilagay mo sa public gusto mong makita. Kaya lang, ito ang dapat tandaan. Informed consent ay kailangan pa rin sapagkat kung ikaw ay binigyan ang access para makuha yung impormasyon na yun, hindi nangangahulugan na binigyan ka ng access na gamitin yun para sa iyong pananaliksik. Kasi pag ginamit mo na ito para sa research, maraming mga iba't iba na ang maaaring gawin tungkol sa impormasyon, kabilang na sa pagtukoy ng kung sino yung nag-post at pagsunod sa kanya o pagsubaybay sa kanya. Babalikan natin yung punto na yun. Sa phase 2 ng research, gumamit ng survey monkey para sa isang survey questionnaire. Ang inimbitahan ay yung mga kasama doon sa phase 1 research. So yung imbitasyon na kaya at saka yung link doon sa questionnaire ay ipinadala by direct messaging. So, itong susunod na tanong, yung bang gamit ng survey monkey ay nag-comply sa confidentiality requirements at privacy? Familiar ba kayo sa survey monkey? Doon sa survey monkey, pwedeng kung ako halimbawa ang gumawa ng survey, pwede kong i-set o ilagay sa settings na anonymous ang mga respondents. So, ilagay ko sa setting anonymous, sapat na ba yun para mapangalagaan ang confidentiality at privacy? Naalala ko minsan, kung may mga sagot na kayo, ay ibigay na ninyo, lagay na ninyo sa chat. Magdaragdag lang ako ng isang karanasan dyan. Sa aming ethics committee minsan, merong isang researcher, sabi niya, ang gusto niya ang gawin, gamitin ang survey monkey para malaman mula sa mga high school students ang kanilang kaalaman tungkol sa sex. Kasi meron silang ano ba ang tawag doon? Sex education. So gusto niyang malaman. Sabi niya, ilalagay ko naman sa anonymous ang setting. Kaya wala silang dapat ikatakot. Okay, anong sagot na nakukuha natin?
Okay, Doc. I think most of the participants are saying true. Some of them are saying false. Few of them are saying false, but most of them are saying true.
Most are saying true. Okay. Ang problema sa survey monkey, yung mga ibang gumagamit na ang online platforms, maaaring makuha pa rin yung tinatawag na IP address na ang nagbibigay ng sagot. So, kailangan pa rin matiyak, lalo na tungkol sa mga sensitibong impormasyon na yun ay hindi kayang i-hack. Okay? So, kailangan makapagbigay ng impormasyon dun sa mga participants paano pinoprotektahan ang confidentialidad at anonymity. Ito na ay yung punto tungkol sa tracking na ang IP address. At isang maliit na bagay, kailangan dun sa questionnaire ay merong option to skip items or to withdraw completely. Kasi nga, ang prinsipyong mahalaga na ang participant ay maaaring umurong sa kalagitnaan ng research. Okay. So, ito ang mga ilan pang bagay na kailangan matandaan. Isang kaso na lamang bago mag-wrap up. Ito ay tungkol sa tinatawag na incidental findings. ang incidental findings ay mga bagay na natuklasan sa research pero hindi siya bahagi ng sinasadyang tuklasin. So, itong pag-aaral na ito, ganito ang nangyari. Merong 45-year-old male nag-test positive siya sa COVID-19. Pero may lugar dun sa kanilang bahay. Kaya siya ay hinatid sa bahay at nirelease doon para sa home quarantine. Okay? So, dapat mag-observe siya roon na ang mga distancing, isolation, etc. Okay? So, pinaliwanag sa kanya yung mga dapat gawin. Kaya lang, pagkatapos ng 10 araw, yung kanyang asawa at only child ay nakita na merong moderate COVID-19 symptoms at positive sila. Okay. So, ang ginawa hindi. Kaya sila kaya nalaman na positive silang talaga sapagkat sila ay sinwab at yung mga samples nila ay sinubmit para ma-sequence, para malaman yung strain pati ng virus na meron sila. Sa pagkakataong ito, medyo comprehensive yung ginawa na testing at yung nag-test nakita niya yung tatlong ay they had the same mutant strain pero bukod pa roon tuklasan din niya na yung tatay ay batay sa mga test hindi maaaring siya ang tunay na genetic father nung bata. Kukuha ninyo. So, skandalo. Doon sa pre-test interview, yung tatay at nanay nagsabi pareho na silang yung mga tunay na magulang noong bata. Pero sa test, ang pinapakita, hindi tatay yung tatay. Hindi siya tunay na tatay. Ito ngayon ang tanong ko para sa inyo. Kailangan bang ipagtapat ng mga researcher yung kanilang incidental finding doon sa tatay? At siyempre sa buong pamilya na rin. Mahalaga yung impormasyon na yun dahil all the while yung tatay was under the impression na tunay na anak niya na hindi nagtataksil sa kanya yung kanyang asawa pero hindi pala tama yung kanyang batayan. Sa palagay niyo ba ang researcher ay kailangan pang makialam sa sitwasyon na ganoon? Kasama ba yun sa kanyang mga ethical obligations. Mas maaba siyang tao kapag itinaagulang niya sa kanyang sarili yung kanyang natuklasan. Meron ba tayong mga sagot?
Yes, Doc.
Oo.
I've been seeing here, most of the participants are saying no to no to the question. Yes, I think most of them are saying no.
Oo. No. Okay. Hindi naman katungkulan noong tatay na anong researcher na ipagtapat ang kanyang atuklasan doon sa tatay. Sa totoo lang, ay lumalabag pa nga sa batas kung isasama yung paternity information dahil sa ang paternity testing ay hindi maaaring isagawa na ang walang pahintulot noong tini-test. Pero may mga sitwasyon for genetic reasons din. Halimbawa, kung yung tatay ay merong genetic condition na maaaring maamaan noong kaniyang anak. Okay. So, skip ko na yan. Ang dapat tandaan dito, isa, pagka merong genetic testing ay sasagawa ilang bahagi ng pananaliksik, kailangan ng pre-test at saka post-test counseling at makakatulong ng malaki kung sa umpisa pa lamang ay itatanong na sa mga participants kung sakaling meron kaming matuklasan na maaaring merong impact sa inyong kalusugan. Gusto ba ninyong malaman? So, makakatulong kung may tanong na yun. Kasi kung merong right to know ang mga tao na akalahok sa research, meron din silang right na to know. Maaring gusto nila, pero maaring ayaw din nilang malaman. Okay. Gaya ng sinabi ko kanina, i-skip ko itong mga iba pang kaso, pero ibinigay ko yung PDF kay Dr. Lim, kaya maaaring yung hingiin kung sa tingin ninyo ay makakatulong sa inyo. So, bilang pagtatapos, gusto ko lang i-highlight kung gaano ka-importante ang pagsasabi ng katotohanan sa research. Pagka sinabi mong according to research, ganito ang katotohanan. Katulad ng naririnig natin ngayon tungkol sa COVID-19. Pagka sinabing according to this study, ganito, para baga nga ang puwersa sa atin na ay kailangan tanggapin mo kasi yan ay batay sa pag-aaral. Kaya naman malaki ang bigat ng responsibilidad para maging responsable ang lahat ng mga mananaliksik. Kailangan magkaroon talaga ng competence, mag-aral ng husto para maging competent. Kailangan iwasan ang mga tinatawag na conflict of interest para hindi mapagdudaan. Halimbawa, kung ako yung principal investigator ng research tungkol sa Sinovac, wag ako ang magiging spokesperson para ipagtanggol ang Sinovac kasi ako'y investigator na kasalukuyan pa lamang na nag-aaral sa clinical trial na aking isinasagawa. Wala pa akong karapatan na magsabi, ayan ay mabuti o yan ay masama, may conflict of interest. Ating yun ay financial, academic. Yung iba naman mag-manipulate ng data at nag-fabricate. Hindi ko na ito ipapaliwanag. Gusto ko lang i-highlight na ang mga ganitong gawain ay naglalagay ng mga kapwa-tao sa panganib, nagiging magastos, at maraming mislead dahil sa mga fake news. Itong isang halimbawa, ito na siguro ang pinaka most cited na paper na natuklasan. Ito yung kanyang conclusion. Pero siya ay most cited na na-retract na papel. After about 3 years, doon natuklasan na meron palang fabrication na isinagawa. Pero hanggang ngayon ay patuloy pa rin na sinasait na ang ibang researchers, itong papel na ito, biruhin nyo, umabot na sa 2,537 citations yung kaniyang papel. Kung ako ang nakakuha ng ganyang karaming citations para sa aking papel, ay para akong nasa langit na bilang isang academic. Ang problema, siya pala ay nambobola lamang at siya ay nasa impyerno na ang siyensya. So, ito ang last slide ko. Nagpapakita na merong mga tao na sumusubaybay sa integrity ng mga papeles na ipinapublish at nagpapublish din na ang mga pangalan ng researcher na naretract ang kanilang mga ipinapublish o pinaawi sapagkat meron palang fabrication o plagiarism. Biruin ba ninyo itong si Yoshitaka Fuji, 169 papers niya ang napatunayan na fake news pala? Gusto ba ninyong malagay dyan ang inyong pangalan? Siyempre naman ayaw namin. Ayaw natin ang katulad natin ay malagay sa listahan na yan at sana yan ay maitanim sa inyong isip. At magandang hapon po sa inyong lahat.
Thank you, Dr. De Castro. We will now have the open forum to be moderated by Professor Mark Harvey Adamson of the School of Pharmacy.
Thank you so much, ma'am. Again, good afternoon to all the participants. Thank you, Dr. Leonardo de Castro, for that very informative talk. And we are now open for your questions. Again, please use the chat box in our YouTube live. And I'll be reading their questions, Doc. And okay, now they are saying thank you to you, Doc, for that very informative discussion. So while waiting for the participants, Doc, I'll grab the opportunity to ask a personal question to you. Not a personal question, but my own question for regarding ethics. Since, Doc, you've mentioned a while ago about the online ethics standards that we have to follow. My question is, Doc, based on your own personal point of view, do you think big social media company are compliant with all ethical standards? And yeah, and because of their algorithms, and I think you know that, though, because of the algorithms like Facebook, and even though, just to continue, even though if we want to be part of Facebook, we have to click the terms and conditions, but most of us do not read those terms and conditions. I mean, even I. So, and also for other parties, other people who cannot really understand English, do you think companies are compliant with all the ethical standards? Thank you, Doc.
Yeah. Well, definitely, the big companies, far from being compliant, are actually experts at exploiting the data, the information that is available online on different social media platforms. But it tells us also how small we are as a power against them. I mean that, well, some governments are trying their best to somehow institute certain regulations, but even national governments are having difficulty imposing those regulations because they themselves have to rely on social media in order to be heard. They have to rely on social media to put their message across. So I do not know how we can do it. I do not know how governments can succeed in this regard. You can see how powerful the social media platforms are because they can even shut down Donald Trump. If they can shut down Donald Trump when he was still president, can you imagine what sort of power they wield upon us ordinary mortals? So I'm sorry, like you, I am like you, Mark Harvey, and the other participants. At this point, I don't know how we can do it, but still, we have to be we ourselves have to be respectful when we use information that we gather from social media.
Thank you so much, Doc, for that answer. I think we have a question from our participant. Here's a question from Mr. Sam Hendrik Kamatong. How about getting prices of a set of drugs from a drugstore? I think he's doing a research on getting prices of a set of drugs from a drugstores for price mapping or monitoring through mystery buying. Does the researcher need to seek informed consent from the drugstore owner?
Yes, I like that example because that's in my collection of examples. One doesn't have to get informed consent right away. Why? Well, first of all, the researcher needs to have permission from an ethics committee. Number two, if I were in the ethics committee, I will say you don't have to get informed consent outright because what you are doing in the first instance is something you would do as an ordinary person, even if you are not participating in research. And number three, it doesn't pose any risks to the participant. Okay. I would say something else if after asking the price, one does something else that involves extra intervention. Okay.
Thank you so much, Doc, for that. And we also have another question here, Doc. If the participants will be harmed based on like for the during the interview, the interviewer or the participants mentioned that let's say that the interviewer are doing a research on psychology and the participants mentioned that he is, for example, suicidal or he committed a certain crime. However, during the interview, we promised to the participants that we will make sure privacy. How are we going to deal with that? Should we go to proper authorities to help our participants, especially if he mentioned like he committed the crime or he's suicidal or he wants to harm himself or herself?
Thank you very much. You're getting excellent questions. One has to know first in what capacity the researcher is doing the interview. If I were part of an ethics committee, I would like to make sure that the person doing the interview is knowledgeable enough about particular clues to watch out for. This is where the idea of a competent researcher is very important. You cannot say, I'm just asking questions, so anyone can ask questions. No, that is not true. It depends a lot also on the nature of the questions that you are asking. So if it is something that is done, if the interview is done in the context of psychological evaluation, then the interviewer must have the competence necessary to read clues from the behavior of the participant. Number two, because you anticipate that the participants who are going to be interviewed might have that kind of reaction, then in the protocol, there must be a provision already regarding such possibilities. So it should be indicated there or in a manual what happens if the informant says, actually, I have some suicidal ideations. So they can refer to a professional, or maybe they should ask further, are you seeing a professional? Or would you want to see a professional? So the point is to be prepared for such eventualities from the start. And so that an evaluation, a professional evaluation can be done before the attention of, for example, police authorities is called. There have been actual cases where the researcher instead of going to a professional who was competent to give advice, went straight to a police officer. The problem was that the police officer also needed professional advice. If I go to I'm not a psychiatrist or a psychology professional. If I go to a policeman to complain to someone's suicidal or criminal tendencies, the policeman will have no professional basis for acting. So first of all, go to the professional before law enforcement.
Okay, thank you so much again, Dr. De Castro. So, given in the interest of time, we will now proceed with the next part of this lecture. Once again, thank you so much, Dr. De Castro.
Thank you very much.
Okay, thank you. May I now call Dr. Nancy Felipe, Director of the Continuing Education, for the awarding of Certificate of Appreciation to Dr. Leonardo de Castro.
Good afternoon. I am privileged to present the certificate to our resource speaker. The citation reads, the Philippine Women's University, Taft Avenue, in cooperation with the PW Doctor of Education Alumni Chapter, present this certificate of appreciation to Dr. Leonardo de Castro for sharing his knowledge and expertise as resource speak topic, current ethical issues in health-related social science research for the program Ethics in Social and Health Science Researches on February 27, 2021 via YouTube Live. This is a CPD accredited program with accreditation number 2018-032 2177 for medical technologies with 4.5 CPD credits and CPD program accreditation number 2018-032-2379 for pharmacists with 6 CPD credit units. Given this 27th day of February 2021. Signed, Dr. Nini F. Lim, President, PWU EDD Alumni Chapter. Signed, Marco Alfredo M. Benitez, University President. Thank you very much. Informative topic,
Thank
Dr.
you. Thank you very much. Thank you.
Thank you, Dr. Felipe. May I now introduce our next speaker, Dr. Jacinto Blas B. Mantaring III, Chair, Board of Trustees, Philippine Health Research Ethics, who will deliver his paper on ethics in health science research. Dr. Jacinto Blas B. Mantaring III is a Doctor of Medicine, a Master's in Clinical Epidemiology from the University of the Philippines, Manila, a Fellow of the Philippine Pediatric Society and the Philippine Society of Newborn Medicine. He is very active in the field of pediatrics, newborn medicine, and clinical epidemiology, holding different positions as practice coordinator, assistant director, section chief, and overall chair. At present, he is a core member of the Health Technology Assessment Council in the Department of Health, chairperson of the Department of Clinical Epidemiology at the UP College of Medicine, Chair Sigal Joint Research Board, Department of Health, Board of Trustees of the Philippine Health Research Ethics Network, and Professor of Clinical Epidemiology and Pediatrics at the UP College of Medicine. He is a well-sought-after plenary speaker in numerous symposia, conferences, and conventions, locally and abroad, on topics related to health science research, specifically on ethical issues and legal considerations in human subjects and among children. He was the plenary speaker in the annual assembly of the Forum of Ethics Review Committee in the East Asia Pacific in Taiwan in November 2018 on the topic setting up a public practice ethics committee. His international linkages include membership in the International Cochrane Collaboration on Infectious Diseases and Pregnancy and Childbirth Neonatology consultant at the World Health Organization on adverse events following immunization, President and Chairman of the Board of the Foundation for the Advancement of Newborn Technology and Services Incorporated, and served as overall chair and panel chair of the Research Ethics Committee at the UP Manila. In the area of research in health sciences, he has conducted and co-authored several researches in pediatric and neonatal issues and problems. His numerous publications can be found in local and foreign public health and medical journals. He has also authored several book chapters on research in neonates. An outstanding work he had was a systematic review of health issues of a developing country in the Cochrane, South Africa, for which he was given the Kenneth Warren Prize. This prize is given to both high methodological quality and relevant systematic review of health problems in low-income countries. He was also awarded the Dean's Award for Innovations in Teaching Research Methods in Medical Sciences. On the lighter side, he excels in sports, having been the gold medalist in the NCAA competitions and is an outstanding athlete in the field events, specifically the pole vault. Please help me welcome our speaker, Dr. Jacinto Blas D. Mantaring III.
Good afternoon, everyone, and thank you, Dr. Fabros, for that very generous introduction. Can I be allowed to share my screen?
Sure, Doc.
I'm sharing already na ba? Di pa ba?
It's showing.
Okay, so I hope you can see my slides. Can you see my slides right now?
Yes, Doc.
Okay, and I suppose my audio is good so that I can proceed. So thank you very much to the Philippine Women's University for this invitation and the opportunity to share ethics principles. And thank you actually to Dr. Leonardo de Castro, from whom I have learned a lot, especially on ethics principles. I have been into research ethics throughout my career, initially as a researcher since my residency in pediatrics in the 1980s and my fellowship in the 1990s. But I have been a member or the chair of an ethics committee since 2004. And I suppose that gives me the credentials or the to be able to lecture on ethics in health science research. So the objectives of this session, by the end of the session, the learner or the audience should be able to discuss the differences between the health science researches, biomedical research, basic research, clinical, and epidemiologic. So I intend to define all of that and appreciate the importance of the proper study design given the research objectives. And I thought that the best way to discuss ethical issues will be to discuss the elements of health research ethics as presented in the National Ethical Guidelines for Health and Health-Related Research, which was authored actually by the Philippine Health Research Ethics Board, of which Dr. De Castro is the incumbent chair. And so this is the outline of my talk. Let me start with a few definitions. I will define health science research. I will define biomedical research in the context of health sciences and the relationship between clinical, basic, and epidemiologic research. And I will go through the elements of health research ethics after giving a brief overview of what is contained in our national ethical guidelines. So at present, our national ethical guidelines is a 2017 version, but I would like to announce that at present, even as we speak, there are already plans to come up with a 2022 version. So the revisions are already being made. So let me start with a few definitions. Okay, so what do we actually mean by health science research? Health science encompassing. It includes all biomedical research, health policy, health systems, etc., etc. So simply stated, health sciences is the study of all aspects of health, disease, and healthcare. And the aim is to develop knowledge, interventions, and technology for use in healthcare to improve treatment of patients. So, kasi health. So, automatically, the beneficiaries of health science are people. And there are two parts of health science: the study, research, and knowledge of health, and the application of that knowledge to improve health, cure diseases, and understand how humans and animals function. But since it is very encompassing, as I've said, it may include health policy, it may include health systems research, time and motion studies, etc. The one that is closer to the medical sciences is biomedical research. Okay. And the biomedical research is defined as the area of science, of health science, devoted to the study of the processes of life, the prevention of treatment of disease. So talagang may, I was advised to speak pala in English, no? There really is a focus, no, on diseases and the genetic and environmental factors related to disease and health. And under biomedical research, there is the concept of basic research. And basic research is research conducted to increase the base knowledge and understanding of the physical, chemical, and functional mechanisms of life processes and disease. So it goes to the genetic or even to the molecular level. And this is stated as research that is done for the purpose of increasing knowledge, even without knowing if these basic research discoveries or findings will have an impact on health. So it is fundamental, not directed to solving any particular biomedical problem in humans or animals. This type of research involves observing, describing, measuring, experimental manipulation. It provides the building blocks upon which the other types of research are based. And a basic researcher seeks to add to the store of knowledge, to the knowledge base about how living things work. Okay, as applied, as contrasted to applied research. Applied research is research that is directed towards specific objectives, such as the development of a new drug, therapy, or surgical procedure. It involves the application of existing knowledge, much of which was obtained through basic research, to a specific biomedical problem. And applied research can be conducted among animals, non-animals, in vitro, in vivo, computer models, tissue cultures, simulations, etc. Now, a very specific type of applied research is clinical research. In clinical research, it is the branch of healthcare science that determines the safety and effectiveness or efficacy of medications, devices, diagnostic products, and treatment regimens intended for human use. And this may be used for the prevention, treatment, diagnosis, or for relieving symptoms of a disease. And I need to define another important branch of biomedical research called epidemiologic research. Epidemiology is the study and analysis of the distribution, the who, the when, the where, and determinants of health and disease conditions in defined populations. It's the cornerstone of public health. It shapes policy decisions and evidence-based practice, and epidemiology has helped develop methodology used in clinical research. It makes use of the same study designs, but different perspective and different applications. So major areas of epidemiologic study include disease causation, transmission, outbreak investigation, surveillance, forensic epidemiology, occupational, screening, biomonitoring, comparisons of treatments, etc., etc. And epidemiologists rely on scientific disciplines like biology, statistics, social science, and even engineering. Okay. To put this into perspective, I'm using a 2009 publication by Bernd Rohrig on the relationship of all of these. So in their publication, biomedical research is classified into primary and secondary research. And when we say secondary, it might mean a meta-analysis or a systematic review or a simple review or even a narrative. And this is very important because these do not involve human participants and may not need ethics clearance. But under primary research, we already talked about basic research, which can be subdivided into theoretical. So that's this, theoretical or applied. For theoretical, it includes methods development like physics, chemistry, biology, informatics. For applied, there can be animal studies, cell studies, genetic engineering, biochemistry, material development, etc. And again, I like to put this into perspective, but on the areas of health research ethics, because often these do not involve human participants, basic research may not need ethics clearance. What will need ethics clearance are all the studies that involve human participants, and this can be seen in both clinical research, which can be subdivided into experimental or observational, as well as epidemiologic research, which is also divided into experimental and observational. And I would like to say that both clinical and epidemiologic research makes use of the same basic study designs. Okay. But before we go into an overview of these study designs, let me just go over, I cannot help but go over, kasi teacher ako eh. how we should formulate our research questions. And we use what we call the PICO or the PECO framework. What do we mean by the PECO framework? P stands for population, person or patient. The E stands for exposure, which could be an intervention. The C is the comparison exposure or the comparison intervention, if applicable, because not all researches have comparisons, especially the descriptive studies. And O is the outcome of interest. And I would like to show this to the audience because the type of research or the type of study design will depend on whether your study is descriptive or analytic. So kung descriptive or analytic, kasi kung descriptive, if it's descriptive, then hindi siya, you don't make use of the comparison group, no? It's PEO, patient, exposure, and outcome. And it could be experimental or observational. For experimental, these are the uncontrolled experiments. So those without the control group. Okay, for observational, this can be case reports or case series, single population cohort, or cross-sectional studies. Okay. Now, if the study is analytic, it can still be both. It can still be either observational or experimental. But this time, if it's analytic, there has to be a comparison group. In order to find out if an actual exposure has an influence on the outcome, you have to find out how that exposure will affect the outcome in the exposed and unexposed group. So laging may comparison. There is always a comparison group. So here is where it should be PECO, patient, exposure, comparison, and outcome. For the experimental analytic study designs, we have the clinical trials. For the observational, we can still have the analytic cross-sectional studies, case control studies, or the multi-population cohorts. Okay. And one of the first things I say, which will make your study ethical, is that you should use the correct study design to match the objective of your research. So very briefly, if you would like to describe the disease or a spectrum of a disease and your sample size is small, then you can use a case study or case series or a cross-sectional study. If your study is to determine disease prevalence, you can use a cross-sectional study. If you want to analyze the operating characteristics of a diagnostic test, you use a cross-sectional study or a cohort study. When you want to determine prognosis or disease incidence, you can use a cohort study. For causation, etiology, or harm, you can use a cohort study, case control study, or clinical trial. When you're comparing interventions, a randomized trial, and when summarizing literature, you can use the meta-analysis. Okay, so now with that introduction, let's go into research ethics. I would like first to emphasize why the need for research ethics. I would like to put that premise ahead, no? Why is there a need for research ethics? I can summarize this in one sentence. The ultimate goal of research ethics is the protection of human participants. And what do human participants have to be protected against? You want to protect them, no? For what? From what? From what? Okay, so I will give you a case study. It's a historical study. It's a very important historical landmark. Actually, there are so many historical landmarks, and it would really be nice to go over all of these with you, but I don't have the time. So I just chose one, which I thought was one of the most important. And this historical landmark is the Tuskegee syphilis study. So let me give you a few facts about the Tuskegee syphilis study. First of all, Tuskegee is in Oklahoma, no? And this is one of the poorest counties in Oklahoma. And in the 1930s, there was a research conducted by the United States Public Health Service. The objective of the study was to observe the natural history of untreated syphilis. By the way, in the 1930s, there was no treatment for syphilis at that time. And they wanted to understand the pathology of syphilis. So more than 400 black men with syphilis participated and 200 men without syphilis served as controls. Okay. And these black men in the 1930s, so keep that context in mind, no? These men were illiterate. They were from the poorest counties of Alabama. They were never told what disease they had. They were informed that they were being treated for quote-unquote bad blood. No, bad blood. In fact, if you Google bad blood, you will see that it's syphilis because that's what it was referred to at that time. Their doctors probably had no intention of curing them because they wanted to see what the pathology of syphilis was. And how will you see or document pathology? You had to wait for them to die so that you could do autopsies and describe the pathologic effects of tertiary syphilis. And so there were a lot of ethical issues that we are looking with a different lens. We're looking at it from the modern times. But these issues didn't exist at the time. There was no informed consent. Participants were intentionally deceived. Procedures were done in the interest of research. Spinal taps, for example, were done and they were told that this was free treatment. And the interests of the participants were never addressed. So that was uncalled for. It was not traditional to address the interests of these participants. This is an actual picture doing a blood draw among one of the poorest of the poor. So in 1936, so this study started in 1930. After 6 years, it was apparent that there were more infected men than the controls. And in 1946, that was, 1930, no, 16 years after, results showed that the death rates among those with syphilis was already twice as high as compared to those without syphilis or the controls. Well, you will probably, many of you are already shocked for those of you who are not knowledgeable of this particular case study. But this was made actually into a HBO movie. And it came out in a book by Fred Gray. The sad part of this, it's sad enough that the interests of the participants were not addressed. But even sadder was in 1940, 10 years after the start of the Tuskegee syphilis study, penicillin was already found to be effective in the treatment. So if you were truly concerned about the welfare of these research participants, you should have stopped the study, or we should have stopped the study and started treating them with penicillin. But the study continued well into the 1970s. Okay. The study continued. The men were neither informed nor treated with the antibiotic. And this reached public scrutiny. Can you guess when? From 1930 it started. It reached the public through a press expose by the press in 1972. And it led to an apology by the United States government to the participants of the Tuskegee syphilis study in 1997. Tagal pa. And in the apology, this was a statement by then President Clinton, who I truly admire for his I guess, integrity. No? He said that the United States government did something that was wrong. Deeply, profoundly, morally wrong. It was an outrage to the commitment to integrity and equality for all of our citizens, and clearly racist. So this was an excerpt of President Clinton President Clinton's apology to the Tuskegee syphilis experiments, who at the time, there were still 8 remaining survivors. Okay, what's the good thing that came out of the Tuskegee syphilis study? Oh, by the way, this is the picture. If in case you don't remember, President Clinton is the one on the right. No? He's not one of those who had syphilis. But one of the good things that came out of this study was that as a result of the study, a commission was formed to see to it that researches done on human participants will never become victimized like this again. So to prevent this from happening into the future, there was the creation of a national commission. And the deliverable of the national commission was the Belmont report. The Belmont report, because they were meeting monthly, but the final report was made in Belmont, which is one of the conference centers of the Smithsonian Institute. So Belmont is actually a conference center. It's not a person, and this is the Belmont report, which came out in 1979, and it's entitled Ethical Principles and Guidelines for the Protection of Human Subjects. But it's still better known as the Belmont Report. And they created the ethical principles upon which federal regulations for the protection of human research participants are based. And if in case this will now sound familiar, these 3 ethical principles are respect for persons or respect for persons' autonomy, beneficence, and justice. So these are the 3 most quoted ethical principles. And just be informed that this came from the Belmont report. And I won't go into explaining each of these principles because I would like to focus now on our Philippine National Ethical Guides. So we have National Ethical Guidelines. As I've said, it was created under the Philippine National Health Research System, which created the FREB, the Philippine Health Research Ethics Board. But actually, even before the Philippine National Health Research System was enacted into law, the FREB already existed. And the first guideline came out in, I think there was one before this, but there was a guideline that was released in 2011 and another in 2017. And I had already said that there's a target for a revision of the guideline in 2022. So let me just go over the history of the guideline very, very briefly. So, cognizant of the increase in human research in the Philippines and the need for participant protection, the Department of Science and Technology created the Philippine Health Research Ethics Board in 2006. But the PNHRS law, the Philippine National Health Research System law, was only, the guidelines came out in 2011. The PNHRS law came out actually in 2013. The Philippine Health Research System law, that came out in 2013, and this provided a legal framework for the institutionalization of the Philippine Health Research Ethics Board as the national policy-making body for health research and the palpable groundswell of public support of ethical health research in the country. So the first FREB National Conference, also known as the 14th International Conference of the Forum for Ethics Review Committees in the Asia and Western Pacific, was held in 2014. A global forum was held in 2015. There was a revision of the Declaration of Helsinki and the SIAM's guidelines in 2013, and ethical guidelines for research, for biomedical research involving human subjects were revised also in 2016, which necessitated that the guidelines of the Philippines be revised in 2017. Okay. So let me go over the guidelines very briefly, because to me, if there is any one document that researchers have to be familiar with, researchers and research ethics committee members have to be familiar with, it's the National Ethical Guidelines. Sometimes we refer to it as the NEGHR, NEGHR. Okay. There are two major sections of the guideline: the general guidelines on ethical review for health research, and the specific guidelines on specific research interests, methodology, and populations. And aside from that, there are 19 appendices. So just for your information, very briefly, Appendix A and B are selections from the Philippine National Health Research System. Appendices C and D are memoranda related to ethics review of research involving human participants. Appendices E, F, and G are guidelines and policies for the accreditation of research ethics committees, the content and the format of their standard operating procedures. Appendices H and I are sample templates for the application of ethics review and writing of research proposals. Appendices J, K, L, M, and N are sample templates of documents relevant to the review of research, like informed consent assessment forms, protocol assessment forms, checklists, etc., etc. And appendices O, P, and Q are appendices that detail the composition of the National Ethics Committee and the Philippine Health Research Ethics Board and the Ad Hoc Committee on the revision of the National Ethical Guidelines. Okay, so given that, let's go over the general guidelines. And I'm actually very proud that we in the Philippines have general guidelines that go beyond the three ethical principles that were outlined in the Belmont Report. So in the Belmont Report, it only talks of respect for persons' autonomy, beneficence, and justice. And these are the Philippine versions of this guideline, which makes it more operational. These are social value, informed consent, vulnerability of research participants, risks, benefits, and safety, privacy and confidentiality of information, justice, and so on. And I believe that if we know and take to heart these 7 important elements of research ethics as it is written in our national guidelines, then we will know how to conduct ourselves as researchers and research ethics committees members, and the rest are really just details. Okay, so again, social value, informed consent, vulnerability of research participants, risks, benefits, and safety, privacy and confidentiality, justice, and transparency. So let's go over each one by one. What do we actually mean by social value? Social value refers to the relevance of the study to the existing social or health problem, such that the results of the study are expected to bring. So in other words, the study should have the prospect of improving the lives of the research participant or the beneficiaries of research. So social value can only be realized if the study is scientifically valid, which means that the study design, the methodology, the data collection overall should be able to generate the information supportive of the objectives of the study. And social value can also only be realized if there is a dissemination plan. Because what good is a study if you do not disseminate the results? It's as good as you did not do the study. And I am always very critical of our master's students who do researches as their master's thesis without the intention of having this published. Because what good is the results if after bookbinding their thesis, it just goes to the library? It would be best actually if this is published, and not publishing an important finding, or even if it's not an important finding, not publishing, it's just the same as not having done the study. Okay. So that's social value. Now, what about informed consent? Okay. Informed consent is an application of the principle of autonomy, which is in the Belmont report. No, what do we mean by autonomy? An autonomous person is one who is capable of self-deliberation and making or agreeing to actions as a result of this deliberation. So every person is supposed to be autonomous. In other words, an autonomous person should be able to make a decision on whether or not he will agree to joining a research. But he can only make that decision if he has been given enough information to make that decision. And our national ethical guidelines defines informed consent as a decision of a competent potential participant to be involved in research after receiving and understanding relevant information without having been subjected to coercion, influence, or inducement. And it's also defined in the same guidelines as a process. So do not think of the informed consent as a piece of paper that needs to be signed. It is a process that is begun when initial contact is made with the potential participant, and throughout the course of the study, especially if it's a long study that requires several follow-ups, you should continue to ask the participant if you would still want to continue being a participant of the study. And that is informed consent. To give consent is to value a person's autonomy. And to respect autonomy is to respect a person's ability to make decisions. Now, among children, because the consent is a legal document which can only be signed if you are of legal age, which is 18 and above. But don't forget that there are children who are intelligent enough and competent enough to make a decision on whether they would agree to be included in a study or not. And this is called an assent. So for children, the assent is as important as the consent. And even if the parents consent for the child, if the child does not assent, then that child's decision should be respected. Okay. Dr. De Castro talked about vulnerability in his lecture. No? But what exactly do we mean by vulnerability? Vulnerable participants are those who are relatively incapable of deciding for themselves whether or not to participate in a study for reasons such as physical and mental disability or asymmetric power relations or poverty or marginalization, among others. So there is cognitive vulnerability. When your research participant cannot understand, siguro maybe if that participant has Alzheimer's or is too old, no, or is mentally challenged, then that's cognitive vulnerability. But I think what researchers forget is there is such a thing as juridic vulnerability. That occurs when there is an asymmetric power relationship between the researcher and the research participant. So, for example, I am a teacher and I would like to do a study to document the illicit drug use among my students. Okay? So sensitive yung information, it can be incriminating, it can lead to stigmatization. The most convenient thing to do is to go to my class and say, class, I want you to join my study. Now, do you think the students, even if they don't want to join, will be able to say no to their professor? Because there's that asymmetric power relationship. And that's what we refer to as juridic vulnerability. And this asymmetric power relationship not only occurs between teacher and student, but it also occurs between employer and employee, commanding officer and soldier. A lot of studies are being done among the military, PNP chief and policemen, warden and prisoners, and sadly, doctor and patient. So vulnerable groups shall not be included in research unless this research is necessary to promote the welfare of the population represented and cannot be performed on non-vulnerable persons or groups. Okay, so that's vulnerability. So we talked about social value, informed consent. We talked about vulnerability. Now let's look at risks, benefits, and safety. Research is only justified if there is a reasonable likelihood that the population from which the participants are derived will stand to benefit from the research. So benefits, all research should have a favorable risk-benefit ratio. Okay, so the people should benefit from the research. And sadly, there are still studies wherein there are no direct benefits. By the way, there are benefits which are direct. So the participant will directly benefit from the research. But there are also societal benefits. The participant will not benefit directly, but people who have that same condition may benefit once the results of the study are finished. So all studies, as I've said, should have a favorable risk-benefit ratio. Let me give you an example of a study where there were no direct benefits. No? There was a study that was conducted in one of the tertiary specialty hospitals of the Philippines. And this was an epidemiologic study. The objective was to find out the prevalence of having that beta protein. I can't even remember what the name of that protein was. And the study design was to recruit people who will come in and get their blood drawn. And I think 15 ml of blood, which is equivalent to 3 teaspoons, will be drawn. And to find out the prevalence of that protein and to relate it to their heart disease or to the presence of hypertension. And I asked, I was there observing, I asked, what's the benefit to the research participant? The direct benefit. Will knowing whether they have that beta natriuretic factor or that beta protein, will knowing that they have that beta protein improve their lives? Not yet, no? And yet, you're going to get 15 ml of blood from them. So I said, to me, there is an unfavorable risk-benefit ratio. And it doesn't mean that that study cannot be done or should not be done. What needs to be done is to increase the benefits and decrease the risks. So this will be different if only 5 ml of blood will be taken, or the participants are those who already need a blood draw, like those who are undergoing executive checkup who really needs blood drawn, no? Or perhaps to pay them for their blood, give them snacks, pay for their transportation and lost wages. But the way it was presented was that there was an unfavorable risk-benefit ratio. They would not directly benefit, and yet there were risks of giving blood, especially if these participants were already anemic. Okay, so don't forget that benefits may be direct, or if not, at least there should be societal benefits. But if there is absolutely no benefit, then that is an unethical study. And I don't, well, okay, anyway, for the purpose of this lecture, our ethics committee was asked to evaluate a proposal from the Philippine Genome Center where they wanted to reconstruct the genetic sequence of our national hero, Jose Rizal, from the fourth degree descendants of Rizal. And we asked, our ethics committee asked, and by the way, our ethics committee includes a direct descendant of Jose Rizal. So even she asked, how will that benefit society if we can reconstruct the genetic sequence of Jose Rizal? So yeah, we could not appreciate benefits of this study. But anyway, that's a different story. So risks, benefits, and safety. Okay, so we talked about vulnerability, risk, benefits, and safety, and now privacy and confidentiality of information. So researchers should adhere to the principles of transparency, legitimate purpose, and proportionality in the collection, retention, and processing of personal information. Well, and that is all contained in the Data Privacy Act of 2012. So legitimate purpose, you cannot collect data without a legitimate purpose. Transparency means you have to disclose to the people from whom you're collecting data the purpose of the data collection. And proportionality means you cannot collect more data than you need. Your study will be, for example, risk factors for the development of hypertension. And then you might ask things like, when was it last? When did you last go to Europe, or things which is totally unrelated to the study. So proportionality is also important. And our national ethical guidelines adheres to these principles of privacy, confidentiality of information. So please bear with me, just two more. Justice. When we talk about justice in ethics, we actually talk about distributive justice. Distributive justice means there should be equitable distribution of the burden and benefit of participation in research. In other words, don't take advantage of the poor who will be the participants of the research only to find out that your intervention is so expensive that it will really never benefit the poor because they cannot afford the intervention. And therefore, they bore the burden of being the participant of research, and it will not benefit them. So that's the principle of distributive justice. And justice also states that there should be fair subject selection or fair selection in the choice of the population, sampling, and assignments. Okay. I can expound, pero in the interest of time, let's just go back. And last is transparency. So ethical research shall be characterized by transparency. It is imperative for all parties to be transparent about matters relating to their involvement. And transparency includes the concept of conflicts of interest. I am doing a study for a product, or for example, only to find out I'm a stockholder of the company that markets the product. Therefore, my interest as a stockholder might overtake my interest as a researcher, and that is a conflict. Okay? So transparency is an element of ethical research that promotes confidence in the research enterprise, even when privacy and anonymity need to be preserved about sensitive matters. And transparency imposes responsibilities of the researchers to disclose information about their affiliations, financial interests, or other loyalties. But at the same time, it imposes responsibilities on the research participant to be truthful in declaring their health condition, to be candid in expressing their concerns about their involvement in research. And that's practically it. So these are the elements, again, of research ethics: social value, informed consent, vulnerability of research participants, risks, benefits, and safety, privacy and confidentiality, justice, and transparency. And I will end with, from the point of view of the researcher, what should you write? You know, now whenever you submit a research proposal, there should be a chapter pag thesis, or a paragraph on ethical considerations. And this outlines what should be written in the ethical considerations. Social value. You need to convince your reviewer that the study will benefit the participants, that it addresses an important gap in knowledge. You should justify the study design, justify the population that's used in the study, especially if vulnerable. Don't forget, you can still do studies among the vulnerable as long as it is meant to improve the lives of those who are vulnerable. You need to disclose issues on privacy and confidentiality in accordance with the Data Privacy Act, your recruitment and informed consent process, because there could be unjust recruitment, no? So it's an issue of justice, or vulnerability in recruitment if you're recruiting your students. You should include methodologic issues like justification of the use of placebo. There should be a risk-benefit assessment because of risks, safety, risks, benefits, and safety, and finally compensation. And I'd like to end by just summarizing that we've gone through a few definitions. We've differentiated health science research. How is it different from biomedical research? And what's the relationship of clinical, basic, and epidemiologic research as different types of biomedical research? I gave one case report or case study on the Tuskegee syphilis study as a segue to our national ethical guidelines. And I ended with the details of the elements of health research ethics. Thank you very much for your attention.
Thank you, Dr. Mantaring. We will now have the open forum to be again moderated by Professor Adamson.
Good afternoon, Dr. Mantaring, and good afternoon to our participants. Again, please use the chat box in our YouTube live for your questions. So while waiting for the questions from the participants, that I have a personal question because I'm also teaching methods of research, and I think some of our my students are here with us also. I just want to ask Doc for them to have a better understanding the importance of having ethics review and also some legal implications of what will happen to the researcher if they will not submit their proposal for ethics review, because most of the students are saying, sir, it will take time for the especially for those students who are completing their thesis writing. It will take time.
I understand because I also teach.
Yes.
I teach undergraduate research, and they also always look for shortcut. No?
Yes.
We always say, first of all, our national ethical guidelines are just guidelines. No? They are not laws. So when you violate the guideline, you cannot be arrested or incarcerated or for breaking the guideline. So it's really up to the institution to formulate sanctions so that the guidelines have teeth. If not, people will just violate these guidelines left and right. And it should it's very appropriate, no, because there is a section in the guideline on the role of the institution in research, and that's part of it, no. Second, but this is not related. Well, it is loosely related to ethics, but more related to research integrity. Is that research integrity kasi is honesty, responsibility, transparency for the purpose of making the results credible. Because if you will know that if the study was done honestly, transparently, then the results are credible. The research ethics committees always also adhere to honesty, transparency, but more to protect the research participant rather than making the research credible. So we as professors should actually be promoting a culture that will espouse research integrity. Sorry ha, may construction sa bahay, kaya if you're wondering bakit may nagpupukpok. But anyway, I think we owe it to our students to be models of research. No? And that means that we should not take shortcuts, and we should show our students that we adhere to the processes and to the principles and to the standard operating procedures that have been set by the institution when it comes to research.
Okay, thank you, Doc, for that answer. Follow-up question on that. Can we still submit our research? Because there are some instances before that some students completed their research without, in some cases, without ethics approval. And now they want to publish their research. Can they still submit their research for ethics review as part of the requirement for the publication?
Theoretically, no. Oh, no, because you should never issue an ethics approval in retrospect. Ethics approval should be given prior to data collection. Prior to recruiting your first participant, there should be ethics approval. But there's a way to get around that. You need to tell the student that if they want that published, they have to publish it, but more as a retrospective study. Because that they can just say that we collected this data and we collected it for another purpose, and now we're repurposing the data for a study. And the retrospective study, or studying data that has already been collected for other purposes, can still be published. So that's the way we get around that. But they have to submit a protocol, and that protocol still needs to undergo ethics review, even if it's retrospective.
Thank you so much, Doc Mantaring. Again, in the interest of time, we will now proceed with our last part of this webinar. So again, thank you so much, Dr. Mantaring.
You're very welcome. And should you have other questions, I can always be emailed, and I will try my best to answer these questions.
Dr. Nancy M. Felipe will now award Dr. Mantaring with a certificate of appreciation.
Okay, good afternoon, Doc. It's an honor to present the certificate of appreciation to our esteemed resource speaker. Okay, the citation reads, Philippine Women's University, Taft Avenue, Manila, in cooperation with the PW Doctor of Education Alumni Chapter, present this certificate of appreciation to Dr. Jacinto Blas V. Mantaring III for sharing his knowledge and expertise as resource speaker on the topic Ethics in Health Science Research for the program Ethics in Social and Health Science Researches on February 27, 2021 via YouTube Live. This program is CPD accredited with number 2018-032-2177 for medical technologies with 4.5 CPD credit units, and accreditation number 2018-2-2379 for pharmacies with 6 CPD credit units, given this 27th day of February 2021. Signed, Dr. Nini F. Lim, the President, PWU EDD Alumni Chapter. Signed, Marco Alfredo M. Benitez, the University President. Thank you, Dr. Mantaring, for the informative lecture.
And thank you. It was a pleasure. And
Thank you, Dr. Felipe. May I now refer the participants to the evaluation link as shown in the slide, and you have 2 hours to answer and submit the evaluation form in exchange of your certificate. Thank you. To give us a synthesis, let us welcome Professor Sherwin D. Toriano, Program Chair of the School of Medical Technology.
To our beloved guests, participants, and organizers, good afternoon. Ethics on Social Health Science Researches, a webinar brought to us by the Philippine Women's University Doctor of Education Alumni Chapter and the Allied Health Sciences, is a pioneering effort to advance our understanding of the conduct and ethical considerations in medical research. We are honored to have been enlightened by two luminaries in the field of research ethics, namely Dr. Leonardo de Castro and Dr. Jacinto Blas Mantaring. Dr. Leonardo de Castro expounded on the current issues in ethics in health and social science research, focusing on the conduct of research with human beings, the importance of informed consent, and social responsibility, particularly in online research. Everyone's attention have been caught by the assertion of non-intervening observation, the proper use of SurveyMonkey online, the harvesting of social media posts without the informed consent, handling of incidental findings, and the existence of scientific fake news. It was all very engaging. And all of these, Dr. De Castro effectively conveyed to us despite a voice disorder. On the other hand, Dr. Jacinto Blas Mantaring competently presented to us the differences among the various science and medical researches, stressing on the importance of the proper study design given the research objectives. He also recapitulated the significant events which led to the creation of the 2017 National Ethical Guidelines for Health and Health-Related Researches. The 2017 Ethical Guidelines has two major sections. One, the General Guidelines and Ethical Review of Health Science, and two, the Special Guidelines on Specific Research Areas. Dr. Mantaring expounded clearly on the elements of health research ethics, namely social values, the informed consent, vulnerability of research participants, risks, benefits, and safety, distributive justice, and transparency in research. In all of these, the 2017 National Ethical Guidelines aim to balance the need to protect human participants from harm with the imperative to facilitate the conduct of beneficial health research. And this 2017 version, for everyone's information, also updated the guidelines on research involving alternative medicine, assisted reproduction, emerging technologies, genetics, stem cells, epidemiology, social science, specific population studies, and clinical trials. From the elaboration of our resource persons, what is very prominent and needs to be instilled in the minds of our medical researchers is that the conduct of research should be guided by principles relating to good social values and respect. Researchers should be aware of the limitations as well as the implications of the research. Most importantly, we should realize the responsibilities that come with the research endeavor. And allow me to quote from the Helsinki Declaration that whatever manipulation, intervention, or observation, the well-being of the subject or participant must take precedence. With this, I hope that we may all pursue our medical and social researches more enlightened, resolute, and mindful. Thank you very much.
Thank you, Professor Toriano. Again, may I remind the participants to submit the evaluation within 2 hours. To deliver the closing remarks, may I now introduce all of you to the President of the PWU EDD Alumni Chapter, Dr. Nini F. Lim.
Our distinguished speakers, Dr. De Castro and Dr. Mantaring, President Benitez, PWU officials, the officers and members of the PWU EDD Alumni Chapter, organizers of the webinar, and dear participants, good afternoon. On behalf of the PWU EDD Alumni Chapter, I would like to thank our university president, Mr. Marco Alfredo Benitez, for his dynamic leadership, inspiration, guidance, and support in holding this webinar on ethics in social and health science researches. It is indeed an honor to have you, Mr. President, at this event. We are also grateful to Dr. Helena Young, Chancellor and Senior Vice President for Academic Affairs, for her encouragement and continued support to this undertaking. I also would like to thank the following: Dr. Nenchita Dumlao, Chairperson, PWU Ethics Review Board, for her energetic leadership in promoting ethics in research. We also thank the co-sponsors of this event, Dr. Evelita Sornosa, Director of Graduate Studies, the School of Medical Technology through Program Chair, Mr. Sherwin Toriano, School of Pharmacy through Program Chair, Mr. Mark Harvey Adamson, and the School of Nursing through Dean Dr. Minerva De Ala. I would like to especially thank the different working committees for their tireless efforts in working, collaborating, and coordinating with one another to make this event feasible and successful. It has been a worthwhile experience working with all of you. We are deeply grateful to our guest speakers, Dr. Leonardo de Castro and Dr. Jacinto Mantaring III, for emphasizing the importance of and promoting ethics in social and health science researches. The latest advances in social and health sciences, coupled with technological advances worldwide, have been confronted with many ethical issues. One example is the latest issue on the COVID-19 vaccine. Is it ethical to require everyone to get vaccinated against COVID-19 despite its limitations? This afternoon, our speakers have clearly provided us insights on the importance of ethics and in making sound ethical decisions, especially in the preparation and implementation of our research undertakings. We will face many challenges, problems, and issues in our community and society as well. Research may be the only way to address them, but for research to be relevant, the following will be needed: cooperation, collaboration, consistency, and ethical considerations. The PWU EDD Alumni Chapter truly advocates these elements in research. We hope you can be advocates of these elements in research too, and will have relevant and meaningful research outputs. Let me end this event with the following quotes. Science brings society to the next level. Ethics keep us there, by Dr. Hal Simagon. The most important human endeavor is the striving for morality in our actions. Our inner balance and even our very existence depends on it. Only morality in our actions can give beauty and dignity to life, by Albert Einstein. Thank you very much, everyone, and have a happy weekend.
Thank you very much, Dr. Lim. On behalf of the Philippine Women's University, I would like to thank all of you who participated in this webinar. May I also extend my appreciation to all the working committees and to the PWU EDD chapter, for without them, this would not have been made possible. Again, thank you and good afternoon.